Okay. Another 10 seconds here. Okay. Sorry, having a problem getting you to see my screen. One moment here. Okay, can you guys see my screen now? It should say heavy metal toxicity. Anybody?
Yes, I see it.
Great, thanks so much. All right, so let's get going. Heavy metal toxicity. Um, so the idea here, guys, is, and by the way, over the next week or so, there will be other people joining the meeting. They will be specifically sales. So you'll hear different voices coming through the meetings, not just clinicians, but um, sales managers, sales persons, saleswomen, salesmen, etc. So hopefully we can all learn from what the other has to pitch in. So heavy metal toxicity. Um, this is an area it's extremely hot today. Hot both because it is a health concern, and hot also because there's lots of labs out there to be ordered with regard to heavy metal toxicity. So, what I want you guys to do is think about your population that you're serving right now. Okay. If you live in a certain, or if you treat patients from a certain socioeconomic class where maybe they're living in houses that are extremely old, there's a lot of houses like this in Philadelphia that still have lead paint on the walls, um, houses that still have lead in the plumbing, um, towns that have lead in the sewer systems and the plumbing. Um, there's places in Dallas, Texas, that are neighborhoods that are built near these lead factories, and the lead gets into the air. Um, Also, in cities where there's a lot of, let's say, manufacturing or batteries or building ships or cars, the lead not only gets into the air, but then when it rains, it solidifies the lead into like a powder, and then it spreads over the houses. Okay, so it takes a little bit of thought, not a lot, but what I'm encouraging you to do today is to see if heavy metal toxicity labs is something that would apply to your particular um, population that you're treating. And we'll go over some other things to look for. One moment, there we go. So, general characters. So, the most common heavy metal toxicity is going to be lead, mercury, cadmium, and arsenic. They're mainly produced in industrial activities that we just talked about, and they end up being deposited in the water. So, what we just said is if you live in a state that is surrounded by, next to, adjacent to, or divided by a large body of water, and your state gets a large amount of its drinking water from there, this is a topic you ought to be thinking about. Texas, you're pretty much landlocked, and you're not going to be in that category. So, how do your patients get ingested with get how do your patients get um, lead toxicity? They can ingest it, they can inhale it, they can have skin exposure. The ones that have skin exposure are going to be those construction workers, right? Or the people that work in the battery plants. I don't know where Tesla is. I don't know if any of you out there are in the same town where Tesla is, but right? Tesla, an Apple factory, Apple computers, any of these that have to deal with computers, batteries, electronics, this kind of stuff, right? So if you got a major manufacturer or distributor in your town, then this is a test that you should be considering. The toxicity can be either acute or chronic. Okay, so acute, that's the reason to give the test in the first place. Chronic is the reason to retest, right? Your patient's going to have a metallic taste in their mouth. They'll complain about that. They're going to be local and systemic effects. And, some of the effects that you want to watch out for when they walk in the door and they say things like, I've got tingling in my fingers, right? I can't feel heat or cold very well. Feels like my cell phone is on vibrate in my pocket, even though it's not. Things like this. Most of the metals cause diarrhea, except for the lead, which causes constipation. And antidote's going to be a chelator. So this means that with regard to the chelator, you may have to go out and buy a chelator, something that you believe in, that you can sell in your office as an added product, right? Something that when your patient walks out of the office with you, having been diagnosed with lead toxicity, that they can just pick up a bottle right there on the shelf or wherever you keep your products, your formulations. Okay, so more about lead toxicity. Of course, really, really bad that children, especially children under the age of 6, are exposed to it. And, think Flint, Michigan. And in that situation, you have problems with cognitive ability, also neural peripheral problems, central nervous system problems. Hopefully, that is not something that you're dealing with. Hopefully, your population is just going to be adults that may be exposed to it a level enough to come in and ask you for, or at least you identify the need for, a lead test. More than 900 occupations out there, guys, that expose people to lead, right? I didn't do it, but really, if I owned a clinic, this is what I would do. This is how I would be thinking out of the box. I would Google, what's the name of that website? United States Department of Labor, all right, and lead exposure. I'm just making this up off the top of my head. Put those in quotation marks. Then hopefully you come up with these 900 occupations. Now you've got all these occupations, so then you go to your secretary or whomever has the list of your patients and say, hey, I need a 1-day project from you. Anybody who has any of these jobs, I want you to put an asterisk by their name, and the next time they come in, I want to ask, let's put down on their chart that we're going to ask them if they would like to have a lead test. Right? They do the same thing when you walk into your dentist. Right? I went to the dentist the other day, and he asked me, did I want, I don't know, it was something for oral or lip cancer, some special toothpaste that he wanted to spread in my lips for an extra $25. I didn't need it, but I thought it was both caring and clinical and savvy of him to ask if I wanted this added product. You can do the same with these lead tests, guys. It's just a matter of identifying the patients that are most likely in need of them. So remember, there's some cosmetic and folk remedies out there, so you may want to be at least a little familiar with those. You don't have to be an expert on it, especially if you're not going to treat it. Your job is to order a lab to identify it. Foreign body ingestions, retained bullet, illegally manufactured alcohol. Hopefully, there's not too many people up under that category. And inhalation of lead from a motor vehicle. What does that mean? Okay, so even if you're not in Flint, Michigan, or Detroit, or any place that's building cars, you could be in inner city. You could be in New York City, in Harlem, right? Where there's lots and lots and lots of buses. So people who live in these big cities, who stand on the corner waiting for buses to come by, there you go. If your practice is in a city that has a subway system, people spend a lot of time underground in these subways inhaling the lead from these tracks, the subways that come by on the tracks. Okay, so let's go to the next one. This is just a lot of advertisement. This also, and I go over it as if it's nothing, but these are the kind of things you might want to consider. Having a little flyer in your office that makes them aware of whether or not they are susceptible to having lead poisoning. It's a campaign like anything, guys, right? Um, you pick, you could pick heavy metal toxicity in general, or you could pick one particular metal per month if you want to focus on. What I'm saying is there are people out there who need this and they don't even know about it until you tell them it's better for you and better for them. Pathophysiology, I won't nerd out on that right now. So, except for there's one thing right here. Many of lead's toxic effects also result from its inhibition of cellular functioning requiring calcium. So there you go. What did we just say? Jennifer, if you mind putting this down. What we just said is that not only when you're testing for lead, you should test for calcium levels, right? You can test for calcium levels because the metabolism of both of those are connected. That's it for that one. So here we go. Lead-induced anemia, right? We mentioned anemia last week, but we didn't go into any detail about why a person might have anemia. One of the reasons is lead-induced because your body wants to process iron, right? F2 plus, Fe2 plus iron. It wants to process iron. If there's too much lead, the body mistakes the metal called lead for that metal which it wants, which is iron. You end up having an iron buildup. You end up having the lead poisoning, and you have this microcytic, microcytic anemia. So what we just said is, in addition to testing for lead, what you want to add on to that test, Jennifer, is a CBC. Okay, add a CBC onto that so that you can look at the size and the shapes and the number of red blood cells. Um, so here's another thing you want to check for. I'm not going to nerd out on it, except for I'm going to mention some stuff that you are able to actually measure. So right here, bilirubin, right? So lead is going to affect bilirubin's inside your red blood cells, and whenever a red blood cell breaks open, then bilirubin spills out into the plasma. Why would a red blood cell break open? Well, maybe you have got lead, which was bound in the place of iron. If the iron doesn't bind, you can't make heme. You can't make heme. You can't make hemoglobin. You can't make hemoglobin. Your body sees that red blood cell as weird and destroys it when it goes through the spleen. And here you go, bilirubin spills out. So, Jennifer, if you'd add that, a bilirubin test. Another thing that happens with lead toxicity is the red blood cells are very fragile, right? So we've talked about a disease before called familial spherocytosis. Basically, you take a whole bunch of red blood cells, you put them in some water, and see if they explode. This is a test that you can order in addition to the lead toxicity test. Erythropoietin deficiency. So erythropoietin is made in the kidney, in the proximal convoluted tubules of the kidney. And is that right? Yeah, that's right. So, and this means that this is another substance that you can check for in conjunction with the lead toxicity. It also means while we're in the kidney, right? Because the lead is going to have some toxic effect on the renal tubules. This means that one of the things you can order is going to be a BUN creatinine. Jennifer, please. A BUN creatinine. BUN front slash creatinine. CREATININE. Hope I didn't lose track of my INs. So, erythropoietin test and a BUN creatinine ratio. That BUN creatinine is just simply a test that tests the ability of your kidney to filter out all of the bad stuff that it's supposed to be filtering. Okay. Let's see. basal stippling of these of the red blood cells. That's probably not going to be a lab that you would spend a lot of time ordering. So let's go past that one. That's going to be more of a pathology. So this is back to the renal effects, right? And keep in mind, we're talking about lead toxicity. And so I hope what you're doing is writing down all of these labs that you might check in relationship to lead toxicity. So um, chronic interstitial nephritis alters renin-angiotensin system and may cause hypertension. So no need to check those. Alters uric acid. So Jennifer, if you mind putting that down, right? So lead toxicity results in increased uric acid excretion. I'm sorry, uh, decreased uric acid excretion, which means you basically develop gout secondary to lead. So the thing I'm needing you to write down, Jennifer, is uric acid test, please. Uric acid test. Okay, there are some central nervous system effects for lead toxicity. Um, I am not sure how many of you are into actually testing neurotransmitters. If you are, I don't mind talking about neurotransmitter testing as a standalone topic in a future episode, but I won't go in deeply into those now. Let's look at the bone effects. Okay, so as you know, with a kid, when they have lead poisoning, they're going to have what? They're going to have lead that deposits on the epiphyses of the bone. However, what you need to tell your patient is, hey, if you got lead toxicity, it's going to keep your body from converting inactive um, uh, cholecalciferol, that's inactive vitamin D. It's going to prevent it from converting it into the 125 dihydroxycholecalciferol, the active vitamin D. What did we just say? You need to test vitamin D levels, Jennifer, please. Vitamin D levels when you are um, trying to assess for lead poisoning. There's X-rays, of course, you can take. But that has more to do with kids. What we're talking mostly about today is, the blood labs that you would be doing. Okay. Um, this does not apply, at least for what we're talking about today. This we've already gone over. So this is what a lid line looks like, right? When your patient comes in, you can see this dark line going through the gums. Um, if you were to see it on an X-ray, they call it bone growth arrest here. But the idea is you have these lead lines. You shouldn't have these lines going through here, right? Kind of looks like sand packed one level on top of another. And it's going to happen on the long bones of the kids. Um, so just be ready when you see it. Some of the things that your patient might present with is wrist drop. This has to do with the lead actually affecting the peripheral nervous system, right? So when the lead takes out the radial nerve, you're no longer able to extend your wrist, and that's what it looks like when they come in. And of course, lead can cause cancer. Okay, so if you have any patients who have a history of cancer, or who are, extremely concerned about cancer, this might be something that you want to bring up is having a lead test. Okay, um, we don't need to talk about that. These are the exact numbers that you would be looking for lead. If you order, and when you order it from us at VirtualClinic, it's going to give you an interpretation. So this is really just repeating the interpretation that you're already going to get. And if you have any problems, of course, just give one of us a call. You've got doctors at your disposal to be able to help you with interpreting the results of the lead tests. So this is just basically talking about other countries, which we don't need to do. And then I'm not going to go into the other. I'm not going to go into the other heavy metals yet. We'll do that next week if we do not have Dr. Kanodia. So if we don't have him next week, then we will go into the other metals. These are some of the treatments. It's up to you if you want to sell them out of your clinic or administer them. These don't particularly need any license for you to be able to administer them. And hopefully you never need this slide, the post-mortem appearance of what lead poisoning looks like. Okay, that's all about lead. The next one is mercury, but I'm going to stop right there and see if there are any questions that have popped up. Okay, I've got no written questions. Any oral questions out there about ordering a lead toxicity panel? And we literally just created one, at least Jennifer did, while I was talking. We're going to end up calling that lead toxicity number 2. So any questions out there? Lead toxicity. They could be business questions, profit questions, clinical questions, whatever you got, throw it at me. Yes, the timing. So lead toxicity can happen acutely or chronically. And so the way you want to approach it in your clinic is, like I said, step 1, identify the populations that are most susceptible to lead poisoning. You could either do that by finding a list of the jobs that are most exposed, or finding a list of the neighborhoods, right? And you just Google a few words, and it wouldn't be hard to find a list of the zip codes, etc., that might be overly exposed. How long for detox and chelation? Yeah, it depends on the product that you use, right? So I know of one particular product made out of volcano dust. No, it's not volcano dust. It's made out of the pyroclastic flow from volcano eruption called zeolite. And the recommendation there is that it takes between 6 months and a year, because the idea with lead poisoning, one of the places you really don't want lead, but unfortunately, one of the places that preferentially attracts lead, I don't know why, it just does, is the pituitary gland. The pituitary gland. So you will end up pulling the lead, chelating the lead out of the rest of the body, and the pituitary gland will happen last. The reason you care about this as a clinician is because your pituitary gland is the stuff, it's the organ that puts out your flat pig, right? That's the memory aid for it. Follicular stimulating hormone, which is what women need when they're menstruating. Luteinizing hormone, also used when you're menstruating and when you're pregnant. Adrenocorticotropin hormone, that controls your cortisol levels. So what did we just say? We just said that having lead poisoning can affect your cortisol levels, which, where do they come from? Your adrenal glands. So you clinicians who are interested in always checking whether or not a person has tapped out adrenal glands, or overactive or underactive or burned out adrenals, lead poisoning is another avenue into that. Right. So another reason you care about your pituitary glands is going to be thyroid stimulating hormone. It comes out of the anterior pituitary. And that takes us into where probably each and every one of you probably have at least one patient every day that is about thyroid imbalance. What we just gave you is another entrance into that thyroid imbalance universe via the avenue of lead poisoning. Okay. Growth hormone also comes out of the pituitary gland. No, I skipped my P. And prolactin. Prolactin is something that gets secreted when mommy is pregnant most of the time. And growth hormone. So if you have someone who comes in with growth issues, a child who has a failure to thrive should be a lot bigger by now at 4 years old than, his little brother, but is so much smaller than his little brother. So those are some reasons why you'd be concerned. Repeat testing, how often? Yeah, I'd say about every 3 months, right? Because if you get a baseline, and then if it's going to take 6 months to a year, I would suppose if I were your patient that I don't want to wait a year to know. I would want to know if whatever my intervention is if that is working, whether it be zeolite or yoga, whatever it is, right? You don't want to go a year with that stuff in your body. And let's see, I'm looking at another question. Did you speak of a provoker prior to doing a metal test to provoke the metal out of the tissue and bone? I did not, because I have no knowledge about that. Lita, oh Lita, good to see you out there. So no, but if you know about it, please offer it, and if you want to hear about it, I'll talk about it next week. Uh, I am always anxious to add some pearls of wisdom to my treasure trove of knowledge. So, so there you go, guys. All things are interconnected, right? We're talking about lead poisoning, but really, if you draw these lines out to the periphery, you're talking about anemia. You're talking about thyroid imbalance. You're talking about adrenals. Um, if you're talking about pituitary, you're also talking about sleep. It's hard not to connect these things, and I think what it really comes down to is knowing your population. I would say if there's one really, really effective thing to have your administrative expert do a mission on, that would be uh, the professions of your clients. I know you probably have 2,000, 3,000 clients, but even if it was just dividing them generally into blue collar, white collar, right? That would help. Blue collar, white collar. Or do they live in the city versus rural? Because that helps you out with the ones that are breathing the lead in the subways and the street corners, etc. Okay, got to be creative about this stuff. All right, guys, thank you so much. That's another week. Next week, we will hit Mercury, or we'll have Dr. Kanodia come on and explain, or actually, we're getting him to record how he's using VirtualClinic. I think the numbers were $87,000 last year for labs alone, and that was just the panels, um, plus another $32,000, I believe, for add-ons. You guys have seen the numbers. We've shown you the flyers, and so he's promised to give us a few of his secrets. All right. Thanks for your attention, guys. I appreciate it. I'll see you in a week. Have a great time out there. Bye-bye.